Welcome, listener, to the Deep Dive. Today, we're diving into some really important information you've shared with us, focusing specifically on potential warning signs during pregnancy.
Yeah, vital stuff.
You've essentially asked for a guide, right? To understand what symptoms might mean your baby isn't doing quite as well as they could be, or maybe that there's a serious complication for you.
Exactly.
It's a topic every single expectant parent should feel informed about, and, well, this material gives us a crucial roadmap.
Absolutely. And what we're going to do is unpack the key insights here, sort of translate the medical information into clear, actionable knowledge you can actually use. Look, the goal isn't to cause worry. It's really about empowerment. Knowing about potential red flags that, absolutely warrant talking to a healthcare provider right away. Knowledge is power here, truly.
Okay, let's get into it then. The information lays out 5 main signs that are highlighted as needing attention. It's almost like a quick reference guide to the body's most urgent signals.
That's a good way to put it. These aren't just random aches and pains. They are specific signals from your body, or sometimes from the baby, that something might need looking into urgently.
So let's start with the first one listed,
Mhm.
bleeding. Now, on the surface, that might seem pretty straightforward, yeah?
Yeah.
But its presence during pregnancy is never something to just brush off, is it?
No, definitely not. Bleeding during pregnancy, well, at any stage really, is always considered significant. See, normally once you conceive, hormones kick in, especially HCG, and that stops your monthly period.
Right.
So any bleeding after a positive test and before delivery, well, that's a deviation. It's not expected.
And why is that deviation so critical? What could it actually be signaling?
Well, it kind of depends on when it happens. If you see bleeding early on, say before 20 weeks, it could unfortunately be an early sign of a miscarriage.
Yeah.
If it happens later in the pregnancy, maybe after 20 weeks, it could be a sign of preterm labor, basically. Labor starting too early.
Oh.
And it can also point to issues with the placenta. Remember, the placenta is absolutely vital. It's the baby's lifeline for oxygen and nutrients.
Mm-hmm.
So problems there, sometimes signaled by bleeding, could potentially affect the baby getting enough oxygen. The key takeaway here is crystal clear. You shouldn't have periods during pregnancy, and any bleeding means you need to talk to a gynecologist. Don't wait.
That makes complete sense. It's a fundamental change that needs checking out. Okay, moving on then, let's talk about abdominal pain. We all know aches and pains are pretty common in pregnancy, but how do you tell the difference between normal discomfort and something potentially serious?
Yeah, that distinction is crucial, and it's something that comes up strongly here. It's absolutely true that mild aches, maybe some discomfort in your abdomen or back that kind of comes and goes, very common. Your body's doing incredible things, ligaments stretching, organs shifting.
Not making space.
Exactly. But persistent pain, especially if it's in the lower abdomen or lower back, or pain that just gradually gets worse and worse, that's the signal you need to really pay attention to. Okay.
One of the most serious things this type of pain can signal, particularly early on, is an ectopic pregnancy.
Right. I've heard of that.
Yeah, it's when the embryo implants outside the uterus, usually in a fallopian tube. It's a life-threatening situation and needs immediate medical attention that often causes severe, sometimes one-sided abdominal pain.
Wow.
And severe abdominal pain, especially if it's paired with bleeding, can also be an early sign of miscarriage.
So the message is, if you're feeling intense, worsening pain, you need to act fast.
Precisely. This is flagged as a situation where you need to contact your healthcare provider immediately. Getting an ultrasound scan, particularly in the first trimester, is so important. It helps check the baby's location, their well-being, and helps figure out what's causing that pain. It's about getting clarity fast.
Okay. The next sign sounds a bit technical. Premature rupture of membranes. PROM is the acronym, right? Can you break that down for us in simpler terms?
Yeah, PROM. It's basically what people commonly call your water breaking, but happening too soon.
You see, inside the womb, the baby is nicely protected in the amniotic sac, which is filled with amniotic fluid. This fluid is incredibly important. It cushions the baby, helps lung development, acts as a barrier against infection.
Right.
Normally, this sac breaks just before labor starts, signaling delivery is near, but premature rupture means the sac breaks before 37 weeks of pregnancy. And it might not be a huge gush like in the movies. It could just be a continuous trickle of fluid. The amount doesn't matter as much as the fact that the sac has opened early.
And why is the water breaking early such a problem? What are the risks?
Well, the main issue is that the protective barrier is gone. Once those membranes rupture, both you and the baby become much more vulnerable to infection.
I see.
Plus, it can often trigger premature labor and delivery, and that comes with its own risks for the baby, especially if their lungs aren't fully mature yet. It's clearly stated. If this happens, whether it's a big gush or just a little trickle, especially between, say, 7 and 9 months or even earlier, it's a serious issue. Needs urgent attention.
But it sounds like there might be things that can be done.
Yes, that's the hopeful part. While it is serious, it's also noted that with prompt medical care, like giving antibiotics to prevent infection or maybe steroids to help speed up the baby's lung development, if an early delivery looks likely, the outcomes can often be managed effectively.
So recognizing that sign and acting fast is absolutely key.
Absolutely. Don't wait. If your water breaks before 38 weeks, or even if you just suspect it might have, get in touch with your healthcare provider right away. Don't just wait and see.
Okay, got it. All right, this next one feels very direct. It's about communication from the baby. Less movement.
Ah.
When should you generally start feeling those movements? What counts as less?
Yes, those amazing little kicks and flutters. You usually start noticing them around 20 weeks or so, about 5 months in. Some might feel them a bit earlier, some maybe closer to 24 weeks, particularly if it's your first pregnancy. Now, if you haven't felt any movement at all by 24 weeks, that's definitely something to mention to your doctor. It could potentially indicate an issue like the baby not growing properly.
Okay.
But monitoring movement becomes particularly vital in the third trimester, so from about 7 months onwards. A significant decrease in the baby's usual pattern of activity, or worse, a complete absence of movement, that can be a critical warning sign.
Why is that?
Well, sometimes babies who are in distress might reduce their movements to conserve energy. So a consistent lack of movement or a big drop-off can be their way of signaling that something's wrong. Problems often give signs, and this can be one of them.
How can someone reliably keep track of this? It feels like it could be subjective,
It can feel that way, but there are methods. The idea of kick counting comes up. A common benchmark is feeling at least 10 distinct movements, kicks, flutters, rolls within a 2-hour period.
10 in 2 hours.
Okay. Yeah. And a simple way to check this is maybe after meals, when babies sometimes tend to be more active. You could lie down on your side for an hour and just focus. See if you feel maybe 4 or 5 movements in that hour. Doing this perhaps after each main meal, so about 3 times a day, is often recommended to get a feel for your baby's normal pattern.
So it's about knowing their normal pattern and noticing a change.
Exactly that. What you're really looking for is a significant decrease from what's usual for your baby. Like if they're normally very active and then suddenly become very still for a long period, or if you consistently count noticeably fewer than 10 movements in that 2-hour window, that's the flag.
And if you notice that change, what then?
The advice is very clear. Contact your healthcare provider immediately. Don't hesitate. Ever. If you're worried about your baby's movements, make the call. It might require an urgent checkup, maybe monitoring, just to make sure everything is okay. Trust your gut feeling on this one.
Okay, that's really important advice. Finally, the last sign mentioned seems to relate more directly to the mother's health, connecting a severe headache with vision problems.
That's right, and it's a really crucial one. Look, it's pretty normal in the last trimester to get some mild swelling, maybe in your legs and feet, fluid retention, the pressure from the growing baby.
Yeah, gravity.
Totally. But what we're talking about here is different. If you get a severe headache, one that's persistent, doesn't get better with rest or simple pain relief like acetaminophen, and it comes along with changes in your vision like blurriness, seeing spots or floaters, or being really sensitive to light, that combination is a major red flag.
Okay, why that specific combination?
Because that pairing, severe headache plus vision changes, can be a key sign of preeclampsia. This is a serious pregnancy complication involving significantly increased blood pressure.
Huh?
And there are other potential symptoms mentioned too. Noticeable swelling, not just ankles, but maybe in your hands and face. Pain in the upper abdomen, sort of under the ribs, and sometimes rapid, sudden weight gain that isn't just normal pregnancy gain.
So a really bad headache plus vision changes, or maybe those other symptoms like facial swelling or upper belly pain.
Yeah.
That's a big deal.
Absolutely a big deal. If you have a headache that lasts more than, say, 24 hours, especially if it's coupled with those vision problems or any of the other signs we just mentioned, you must seek medical help as soon as possible. Preeclampsia needs prompt diagnosis and management. It can be dangerous for both you and the baby if it's not treated. It often requires close monitoring, sometimes medication, and sometimes even means delivering the baby early.
Wow. Okay. So just to recap this deep dive based on the information you shared with us.
Hmm.
We've covered 5 key potential warning signs during pregnancy that signal you need to contact a healthcare provider right away.
That's right.
Those were any bleeding at all,
Mm-hmm.
severe or worsening abdominal pain.
Yeah.
Your water breaking prematurely before 37 weeks.
Correct. Premature rupture of membranes, or PROM.
A significant decrease in your baby's usual movements.
For sure.
And finally, severe headaches, especially when they come with blurred vision or other specific signs like swelling or upper abdominal pain.
Exactly. These symptoms might indicate a problem. Could be with the baby's well-being, could be a serious complication for you. The bottom line, the strongest emphasis, is that if you experience any of these, you must consult your gynecologist or healthcare provider immediately. Get those checks done, like an ultrasound if needed.
Yeah.
Don't try and self-diagnose or just wait it out. Prompt evaluation is key.
You know, what's really striking about all this is, well, it's the power of just being aware, isn't it? The information makes it so clear that early intervention, getting that medical help as soon as you notice one of these signs, can potentially make a huge difference.
It really can. It truly highlights how knowing what to look for, being tuned into your body, and then trusting your instincts enough to actually pick up the phone and seek help. It's just so important for both your health and your baby's health.
It really makes you think about that connection, the signals your body sends, and just how critical it is to understand them during such a transformative time.
Absolutely. That interconnectedness and the need to listen. Really listen.
Definitely something important to keep in mind.